Hello everyone, my name is Adrita and I'm from India. I think we already discussed about why everyone chose Texila, but one of the main things I'm here to talk about is the clinical experience. So unlike other countries, I think Guyana has an upper hand because we have hands-on exposure, which means we get to touch the patients, which gives us an upper hand not only as medical students, but also as doctors as a whole. And the resources Texila has, be it e-books, online journals, research papers, physical books, hard copies, really helps us in both our basic science and clinical exam. The accreditations Texila has is very much compared to the other universities in Guyana. And apart from that, they also have a policy of an open door policy with the dean. So if you have any trouble, you can go and discuss with them. About the faculties, they are experts in their specific fields and they are always ready to help us and guide us through whatever we want. So overall, I think it has been a wonderful experience, and if I have to just put it in one word, I would say my journey was transformational.